Ministries. While Jesus Christ is exalted and hope is inspired through fervent prayers. We pray a lot in this ministry because that is what we believe in. And that's our pastor, Pastor Desfashikwe. And our morning pastor is on the way. And we have some of the ministers in the house. Bro Ladimeji is one of the ministers. Can you stand up for recognition, sir? Deacon Victor Obeido, one of the ministers. Bro Peter Agu, one of the ministers. Deaconess Bosa Akifisoye, one of the ministers. Deacon Taye Akunwekomi. Deaconess Peace Obi. Thank you. And my humble self, Margaret along with me. Thank you. In this ministry, we always start the service, I would say, like 9 o'clock, because that is when the prayer the prayer group, they meet to pray for the beginning of the service, between 9 to 9:20, 9:30. Then 9:30, we always do our Bible study every Sunday. It's very interactive. We use it to ask questions about Bible stuff that we need to clarify. But today, we are using that period for this educational program. That made us understand that it's a very, very important thing that we have to talk about. So that's why we are using this period for that. And I'm very sure most of us, because we have been aware of this for a long time, I'm sure we have all our questions down. You should be ready to ask questions. Clarify everything that you need to clarify. And so between 9:30 to 10, we do the Bible study, like I've said, and the real service itself starts at 10 o'clock every Sunday. For today, just bear with us. Whenever we start, we start. We just want us to make a very good use of this opportunity from MDwise. Yes. So, and also on Tuesdays, we do fasting and prayer between midnight and 6 o'clock. And we break the fast between 6 and 6:15 in the evening. And also, after that, we also go into our breakthrough prayer meetings. That's on Tuesdays. And Saturdays, it's not everything about prayer and prayer. We need to pray for real. We also work out for Christ. We work out to keep fit. And because of the weather outside, we do it right inside the auditorium here every Saturday, the first and the last Saturday of the month. And we also do our Yoruba translation of the breakthrough prayer meeting that we do on Tuesdays, also on Saturdays. So I welcome everybody to this program, and I pray that we will be richly blessed in Jesus' name. So I'm going to introduce the man from MDwise. He's here today to educate us on what it is about Obamacare that's going on outside there. What are the things that we need to do? How do you register? How do you make yourself available? And to have a health plan that will be very good for you and for your family. God will bless us as we listen in Jesus' name. One more time, welcome, Mr. I want you to introduce yourself to everybody.
Hi, hello. My name is Gabriel Gonsalves from MDwise. I'm an outreach coordinator. We have a group of around 5 to 6 people in our team that just goes out in the community and make these presentations kind of to educate everyone. There's been a lot of things on the news that may not be as accurate as the actual law is. So we're trying to come, anyone that wants more information, we'll always make ourselves available to the community. Materials here. Would you mind distributing some of these?
Oh, okay.
This will just help people know eligibility and things like that. Just these for now. Yeah, and then the other one. Thank you. What they're testing out right now is the federal poverty line according to the government, and that we can talk a little bit about soon, but this will go towards people's eligibility, towards people tax credit from the government to lower monthly premium, and plans and things like that. So, and the other sheet is just an FAQ, it's just brief, who's eligible, some of the deadlines, how to apply, and what happens after you apply. I was going to start talking about the law overall right now. The healthcare reform law, also Obamacare, also Affordable Care Act, it's all the same. It's just different names that people call depending on who you're listening to. I'm going to refer to as the healthcare reform, just because that's what we're usually talking about. There's 4 major provisions in the healthcare reform that people may not know about it. One of the first provisions is that pre-existing conditions must be covered from your first year coverage through your insurance, which means that if you have diabetes or if you had cancer, before this year, you cannot find new insurance because all insurance companies say that's a pre-existing condition, we're not going to cover that, so you have to go out on your own and pay for it. We all know those are very expensive diseases to cover, so the government decided that health insurance will not be able to do that anymore. Then if you have a pre-existing condition, your insurance company has to cover that pre-existing condition. Anyone that tells you otherwise, they're breaking the law. Just, report them to the Department of Insurance. We still have heard about some people still doing that, saying that you cannot get this insurance because you have a pre-existing condition, but starting 2014, there's discrimination that is not allowed. Another one is that there's no more annual or lifetime limits on your insurance policy. So again, if you have a disease, a chronic disease that costs a lot to treat, for example, cancer treatments can cost all the way to $5 million to treat, your insurance company cannot drop you in the middle of that coverage because you reach an annual or lifetime limit for your coverage. If you have insurance, you continue to make your payments, they have to continue with that coverage for you. The third one is the coverage for children. All children are allowed to stay on their parents' plan until they turn 26. It does not matter if they're married, if they're working, if they live in the house or not. As long as they're under 26, they're allowed to stay under their parents' policy for insurance. And the fourth one is that all preventive services must be covered at no cost to the insurance people, to the insurance clients. And there's an actual list of what the preventative services are. So for example, sometimes colonoscopy will be covered, screenings for high cholesterol, obesity, mammograms, and there's also different categories of preventive services. There's adults, there's women, and there's children. So women must be aware that they have some extra preventive services that men don't have, such as the mammogram. Does anyone have any questions about these 4 major parts of the law? Yes, sir.
The children are supposed to stay under they can stay under their parents.
Yes, until they turn 26.
But right now, there are some of them that are not under the parents. Initially they will say no, they can't. So, what is happening now is the parent gets insurance.
Yes, they should be allowed to move the kids into their insurance. And there's a little bit difference because if the child is Medicaid eligible, then they might not be eligible because they have to stay with Medicaid. For example, and this is getting a little ahead, but in the marketplace, children can stay in Medicaid programs and the parents can go into the marketplace and get policies for themselves. And the reasoning is Medicaid and marketplace will cover the same the same services, but Medicaid is a lot cheaper to the parents because your co-pays are lower, you don't have a deductible sometimes. So the government allowed for children to stay into the Medicaid, which becomes cheaper for the parents while the parents are on the marketplace. But again, if the child is Medicaid eligible, then they're not eligible to come into the marketplace for their parents' policy. But the child is not eligible for Medicaid, then they can stay under their parents' policy until 26.
I just don't want to jump what you have.
Yes.
But there's this question, just what you said now. If the parents are if the parents are on Medicaid and the children are on Medicaid, all of them,
yes,
like maybe four family of 4 people, all of them are on Medicaid and they are still qualified, even till now. So what they continue or they have to go to the marketplace.
And this is, did everyone receive the income guideline sheet? Yeah. Okay, so eligibility, it differs a little bit, it differs a little bit for the parents and the children. We're going to talk about the parents first. For the adults, your eligibility is based on your income. If you make above 100% of the federal poverty line, you're eligible for the marketplace and you'll not be eligible for Medicaid. And if you make between 100 to 400%, then you're also eligible for tax credit from the government to lower your monthly premium. And the way it works is you see how many people you have in your taxes when you apply. So let's say a family of 4, a wife, a husband, and 2 kids, they will be considered a family of 4. So if they make above $23,550, the parents will be eligible for the marketplace program, and they will have tax credit as long as they make below $94,200. The eligibility for children is a little bit different because the Medicaid programs for children, the income is higher. So for children, if the parents' income are up to 250%, they will be eligible for the Medicaid program, the Hoosier HealthWise, and that's where they will stay. One of the good things is that if you apply for the marketplace, at the end of the application, they pretty much give you everyone's eligibility. So even if you include the children in the application, it would say your children are eligible for Medicaid, and you will send the information to Medicaid.
Okay.
So that's a good thing, because if you're unsure what to do, feel free to include them in there, and it will kick them out to Medicaid automatically. Does anyone have any questions about eligibility or children, or?
I have a question.
Yes, ma'am.
If you have a job and your child is already insured with you, but your premium is pretty high, can you leave yourself on your job insurance and see if your child is eligible for HealthWise?
Okay. Yes, you can. And again, what you would do is, as long as you're making below the 250% of the federal poverty line for your household, your child should be eligible for Hoosier HealthWise. And the Medicaid programs have also changed beginning in January. Before this year, Medicaid also counted your resources, so a house, a car, things like that, all went towards your income level. Starting this year, Medicaid is also going based only on your income. A little bit, something that differs between the Medicaid and Marketplace is that Marketplace, they go by who's in your taxes. So who's your dependent, do you file jointly, things like that. Medicaid still going off how many people live in your house. So that's an important distinction, because you can live with a house with 15 people, and for the Marketplace, as long as you only apply with you and your child, that's only counts as 2, but Medicaid counts all 15 people. So that's a weird distinction that some people are not eligible for the Marketplace, they may not be eligible for Medicaid because they live in a house with a lot of people, and Medicaid's counting everyone's resource, not just the people who are applying their taxes together. Does that make sense? And about employer insurance too, if your employer offers you insurance, you're technically not eligible for the Marketplace for the tax credits. However, and this is right here, number 4, the 4th line. If your employer insurance costs more than 9.5% of your income, then you would be eligible for those tax credits. And honestly speaking, we've done a lot of enrollments. If you are offering employer insurance and it's less than 9.5%, a Marketplace policy will be more expensive probably. So you don't want to cancel that application before checking the Marketplace. You want to stay with your employer, talk to someone from the Marketplace who will make those calculations for you. It can be quite simple, it'll take about 30 seconds, and then you can see which one's the cheapest. But don't cancel your employer coverage thinking that you have the tax credit before you know that you do, because your employer insurance kind of cancels that tax credit. And to make that calculation too, there's actual Appendix A that your employer HR department fills out that pretty much just says, is this employer eligible? If yes, how much is it for the cheapest policy? And that's the catch, it's the cheapest policy, not just a policy that you would want. And if he's not eligible, when will he or she be eligible for insurance? And another key question is, does this insurance cover the 10 essential benefits? And I have it in the brochure here with me. If anyone would like the brochures too, feel free to grab some. I just, pass it out. People that don't need them, but the 10 essential services that all health plans must cover too, based on the healthcare reform, is ambulatory patient services, emergency services, hospitalization, maternity, mental health and substance services, prescription drugs, rehabilitation services, laboratory services, preventative services, again, at no cost to the clients, and pediatric services. So again, if your employer insurance costs over 9.5%, or if it does not cover one of these 10 essential services, you are eligible for the Marketplace tax credits. if it costs less than 9.5 and it covers the 10 essential services, you're not eligible for the tax credits. That makes sense for everyone? Any questions? Yes, ma'am.
My question is, let's look at this.
Okay.
If you are an individual paying $11,490, you're making more than $11,490. Someone would like to know that. What is the calculation there? Because if it is broken down, someone will easily see that, okay, this is it 5% that you're supposed to pay per month, or 10%? That way, I think people will get to understand that. But to see the bulk number, they say, oh, 11,000 or 15,000. Sometimes they'll just come and drop it down. But I think if they see the calculation where it's like, maybe I'm going to pay 5% monthly or 10%, that way I think it'll be much more clearer. So can you please clarify?
There's a percentage that the government caps on how much your insurance can cost you, and then they subsidize the rest. However, that's kind of hard to comprehend and tell everyone because it's so specific to their household. What we have done at MDwise is we put a calculator online, and people can calculate that percentage specifically. And I can grab my iPad and do one for you as an example. And all we need information-wise to calculate that premium for the household is zip code, income, and then information about the household. So how many people are in your household, what are the ages of the people applying, and things like that. So I'm just going to turn it on and do a quick example. So I'm making an example here, just making it up off the top of my head. I'm making a household of 4, so 2 parents, 2 children, and their income is $32,000. So if you look right on the sheet, they're about 135% off the federal poverty level. So what that means for them, insurance plan, everyone will qualify for 3 different levels of insurance: the bronze, the silver, and the gold. The bronze will cover about 60% of some of the expenses, and the gold will cover about 80%. The silver plan can range because depending on your income, you also get extra tax credits to lower your out-of-pocket costs. So your deductible might be lower, your copay might be lower. When you go to the doctor, everything will be lower. So the silver plan can cover between 70 and 94%. And the way it works is that, and it's also in our brochure if anyone has specific questions about that, but if anyone reads a brochure later, you see that silver plan has 4 different levels, and each different level below that has the federal poverty guideline underneath it, so you know which silver level you'll be getting based on your income. So for the family of 4, I just did at $32,000 income. For the 4 of them, only the parents will be eligible for this because, again, the income is at 134%, so the children will go into Medicaid, but the parents will go into the marketplace. Bronze plan will cost 0 for them. The government will give enough tax credits that they wouldn't have to pay anything for the month of the year. The silver plan will costs about $87 a month for the parents, and that will cover about 94% of the medical expenses. So they would have no deductible. Their maximum out-of-pocket would be $1,000. It would be an extremely low plan for a family of two. And again, the Gold plan will cost about 233%, but they wouldn't worry about the Gold plan because the Gold plan covers 80, while the Silver covers 94 at a much cheaper price. So, and that's why you have to be careful if you apply on your own. You might not necessarily need the Gold for the extra coverage. You might be, yes, your Silver may cover more and cost less. That's something you might want to check as well. Does that kind of help a little bit with an example like that? Yes, so the closer you are to the 100% of the federal poverty line, the more tax credit you have from the government, so the lower you have to pay every month. And depending on your income, the lower your out-of-pocket costs are, the lower your deductible, your maximum out-of-pocket, co-pays, things like that are. And again, this too is just on MDwise.org website, and I also have some cards that will have our call center number on it. I also give my card to anyone that needs it. We can also do that calculation over the phone. It's easy, it's fast. As you saw, it takes less than 30 seconds.
Okay. I'm just creating a scenario. The family has the children on Medicaid, and the children are using MDwise doctors.
Yes.
And now the parents are going to the marketplace to pick MDwise, and just, the parents want to pick MDwise on the marketplace. The children are on Medicaid using MDwise doctors. Is there any clash of interest there, or?
No, one of the benefits is that with MDwise, we also offer the Medicaid program, so the whole family can be under one specific company. Now, the whole doctor, it differs which doctors will cover Marketplace and which doctors will cover Medicaid. We have a database online on which doctors will cover which one, so the parents can kind of separate, okay, this will be covered for me, children will be covered here. So the networks are a little bit different. For Marketplace, for example, MDwise has IU Health, St. Francis, St. Vincent's, and Eskenazi. Methodist, yes. IU Health, Methodist, yes. And again, this bulletin also has all the hospitals we cover. But for Medicaid, we have IU Health, St. Vincent's, and Eskenazi. So St. Francis is not into our Medicaid network, so there's kind of a difference in there. And again, it's also doctor specific, because a doctor can choose to take Medicaid and not Marketplace, or they can choose to take Marketplace and not Medicaid, or neither, or both. So, but again, if that happens, with MDwise, always feel free to just call our customer service, and we can help with that kind of decision, because a lot of parents would like to take their kids to the same hospital as they go, just to keep all under one hospital, and we can help finding a doctor within that hospital that will either see both, or, okay, parents have to see this, kids have to see that. So, and that's one of the benefits of having the same company for both plans, Medicaid and the Marketplace. You can keep everything under one roof, and just becomes a little easier. Yes, ma'am.
Yeah, my question is that this Eskenazi with an advantage, if you have it, are you still going to have this MDwise Marketplace? Are you still going to apply?
Yes, and for two different reasons. One, the Wisher Advantage is not considered a health insurance plan under the government side because it doesn't cover the 10 essential benefits. So even if someone has Wisher Advantage, they will still have to pay the penalty. And we can talk about the penalty in a little bit after some questions. Yes, they'll still have to pay the penalty because it's not considered health insurance. But also, we work with Wisher, and what they told me is that Wisher, every time you go and you reapply for Wisher, Wisher is going to make you apply for the Marketplace if you're eligible. But you can still have your Wisher Advantage as a secondary to your Marketplace. So you can have your Marketplace policy, and if you have Wisher Advantage, when you go into Wisher, things are higher, it's still discounted. But if you're eligible for the Marketplace, Wisher will tell you to apply for the Marketplace so you can continue with your Wisher Advantage.
Another question, family of 5, I have 3 kids, and we do not have Medicaid. And I'm eligible to this household income. So when I apply for this MDwise marketplace, are they gonna be automatically approved for Medicaid?
They're not automatically approved. What happens is, even on your result applications, that we have sent their information to Medicaid, and then either Medicaid will follow up with the family, or the family can call the Division of Family Service directly to follow up with that application for the children, if the children get put into Medicaid.
Excuse me, please, can you shed more light on this Richard advantage?
Yes.
Because quite a lot of people are, I'm on Richard advantage.
Okay. And I'm going to talk, I'm not from Wisher, so I don't know all the details, but Wisher Advantage is just a program that you kind of go into Wisher, and it's on a paying scale. So based on your income, it differs how much you're going to pay each time you go see a doctor or each time you need a service at Wisher. And again, that service will continue for next year, and as far as I know, will continue. But if you're eligible for the marketplace, and they'll check your eligibility when you go in to renew your Wisher card, your Wisher Advantage.
Okay.
Yeah, they will automatically check your eligibility, and if you're eligible, they will tell you that you have to apply for the marketplace in order to have that Wisher Advantage for the following years.
Okay.
And if you have any questions about this, also contact Wisher directly, because again, we're not part of them, so this is things that we're hearing from their employees. But it's always better to get it straight from the source from them to see what the process internally is.
I have a question.
Yes, sir.
You talk about network. Okay, what if I have my doctor that is not in the network, and I still want to keep my doctor that is out of network? Then what would be, is it more premium or what?
What happens is these are the HMO plans. So if a doctor is not in our network, they will not be covered at all. So you either have to switch your doctor to have one in the network, or you can try to find a plan that has a doctor in the network. For example, the way it works is that MDwise has the IU Health, St. Vincent's, St. Francis, and Wisher or Eskenazi. They're going through a name change. While if you look in Marion, Community and Eskenazi are also with Anthem. So depending on where your doctor is, you have to go into one of those two plans based on where your doctor, what network is for your doctor. And again, we can check online if your doctor is in MDwise or not. And some doctors are choosing to not be a part of Marketplace at all. So you might have to go into a private insurance to have them covered. And the way it works too is that even though our network, for example, MDwise is those 4 hospitals, if you have an emergency and you go into another hospital, that will be covered because it's part of an emergency. As long as it's considered a medical emergency, your service is still covered as if it was in-network. And as soon as you feel better and you get well, then we'll transfer you into our in-network hospitals.
I was going to ask, if you're out of state and you fell sick and you have to go to the hospital, what happens? Are you covered?
If you're out of state, the only service covered are your emergency services. So if you're out of state and you break your arm, feel free to go to any hospital. Again, you'll get covered as if it was in network. But maybe if you have a earache or something and you go out of state, that service will not be covered because it may not be considered a medical emergency. My advice is, MDwise will have it, and I'm pretty sure Anthem will have it too. It will be a 24-hour nurse hotline that you can call and kind of say, is this an emergency, is it not? Well, how should I proceed going forward? And they can help you like, yes, this service will be covered, this service will not be covered. But we also have pamphlets at MDwise that says what is an emergency and what is not. So the way they define emergency is if there will be lasting harm to you if you don't seek medical services immediately. So again, if you break your arm, that's always considered an emergency service, but feeling like you're getting the flu, that might not be an emergency.
Something else, I don't know if you covered this before I came in, but you can see our population here, we have mixed. We have the older group, and they probably don't have any income. They probably come to look after their grandchildren. How do they fit into the family plan? You know, they can fall sick too because they are humans, and so what happens to them?
And this is a little bit more into the eligibility for Marketplace, because to be eligible for our Marketplace plan, you have to be legally in the United States.
They are legally in?
Yes, and they have to be under 65 years old, because once you turn 65, you're technically eligible for Medicare, and you cannot have Medicare and Marketplace together. So,
So another question, is it possible, and I don't know if you addressed this too before I came in, most employers give their employees health care. Do you consider churches as an employee? What I'm trying to say is, can we get a good rate? Can we be like, the church has employed all of us, the church is, we're employees here, and can we get a good rate to make premiums lower?
Not with MDwise right now. They are opening up a small business insurance marketplace where your church could probably go and search for the insurance plans, but that would be starting in 2015 from my understanding. MDwise is not offering one of those, so you wouldn't be able to have a group discount rate with MDwise Marketplace. Our plans are only for individuals, but I think they're called the Small Business Offerings Marketplace, and it will be opening next year. You can still be able to go in there and search for the discounted rate for their groups. What will count as a group or an employer, or what won't count? We are not in that market, so we're not too sure. Our recommendation is always to talk to a company directly that's involved in that market to see what the rules and regulations will be.
I have a question. At my job right now, I'm only allowed to claim me and my children, okay? But like she said, my mother and I live together, and she just came from overseas. So with MDwise, can I claim her? Can I go ahead and claim my mom as being I'm responsible for her?
Yes, as long as you claim her on your taxes.
Okay.
So the way it goes into Marketplace is that as long as you're claiming someone in your taxes, your income can go towards that person, towards their income. So if you have a family of 4 and your mom lives with you guys, you're technically a family of 4, but you can claim your mom's to make a family of 5 in your taxes. And therefore, you will count as all your 5 incomes together for your subsidies, for your premiums, and all your rates and things like that.
Okay, all right.
And that's the important that you have to claim people in your taxes to make the income count. But the other way is also possible that if you live in a house with 7 people and you're only filing your own taxes, you're only putting your own income in there. You're not counting everyone else's income.
My question is, I know you said if we have like our parents that are legally in the state, but say they're not like permanent residents, but they're just like on a visit for a few months and say something up. So are you saying Medicare, can I apply for Medicare for them just for if they have the visitor visa?
For temporary, I don't think you'll be able to, no. What you can try to do is get a traveler's insurance for your parents. And that's handled completely independent market. That's not handled through the marketplace or anything. But I just know that's possible sometimes when you travel abroad. You can get a traveler's insurance.
So, if your wife is pregnant and she's on visa advantage, is it automatically she'll get the Medicaid, or she still has to go through Marketplace?
I would recommend her to apply for Medicaid, just to make sure that her application is in and everything, because I just had this situation with a family that I was trying to help where the wife was pregnant, and the eligibility also changes with pregnancy. It kind of becomes like a children, and your income goes all the way